The important thing about macular degeneration is that people know what symptoms to look out for. The commonest symptoms of macular degeneration are blurring in the centre of your vision or distortion. So for example, people will notice that if they look at a straight line, such as some blinds like those behind me, they'll notice that there's some distortion of the line, waviness as they call it. The other symptom is noticing patches of blurring or central visual loss. Both of these can occur quite rapidly, and by rapidly I mean over a few days to weeks, but the most important thing is that people check themselves regularly. The reason being that it's not uncommon for people to come to see me where they've had one eye affected and not even noticed, because the other eye is effectively covered for it. So it's very important to check yourself. And the way to do that is using an Amsler grid. An Amsler grid is a chart that looks like graph paper that has a dot in the center of it. The important thing to do is to check yourself with one eye at a time. In other words, you put your reading glasses on if you need to, you have a good light above you, and you look at the grid, but with one eye at a time. What you then do is you look straight at the central dot, and without looking anywhere else, concentrating on the dot in the center, you look at the lines around and to the side and make sure they look straight, make sure there are no patches missing, and if that's the case, you're fine, or you're very likely to be fine. It's important to check this in each eye separately, in a nice quiet surroundings with where you're able to concentrate fully. I recommend that people check themselves with an Amsler grid regularly. How frequently depends on whether they've got problems with the other eye or what I find when I look inside their eye. But for most people who've got no symptoms at all but a family history, it's probably worth checking yourself maybe once a month or so.